Hi, I'm Richard Carter and I'll be your host today on This is Surgery. Today we're joined by Mr. Andrea Bille, a consultant thoracic surgeon working in high complexity lung cancer care and someone who lives and breathes minimally invasive and robotic surgery. Andrea's been at the centre of a question every health system is asking: how do we create more surgical capacity without burning teams out or extending the day? In an independent valuation at Guy's and St Thomas's Trust, objective OR intelligence helped recover close to an hour per list, enough to add an extra robotic thoracic case without extending OR hours. So today we're talking about what that looks like in real life, the changes, the culture, and what it really means for patients. So, Ms. Bille, welcome to This is Surgery. You're a consultant thoracic surgeon working across cancer care with minimally invasive surgery and robotics. Oh, that's quite a mouthful. When people ask, what is it you do? How do you introduce yourself and how do you explain to them what it is that you do?
Thank you very much for the invitation, first of all. The way I'm introducing myself, I'm Mr. Andrea Bille, consultant in thoracic surgery. And I'm dealing with lung diseases, and I'm mainly performing keyhole surgery through the robotic technology, removing part of the lung, mainly for cancer diseases.
Okay, perfect. Thank you. And in sort of such a high-tech environment, I imagine that you encounter technology from kind of all directions, and it comes at you all at once in your line of work. I was wondering, how do you think about technology? Are you sort of a natural early adopter? Do you look to get in at the very, very start? Or like me, for example, I wait for the first bug fix release and then maybe I'll give it a go? Or do you wait until something's fully proved out before you'll tackle it? How do you approach technology in general?
I much believe that technology now is an essential part of our job. I like to adopt the technology earlier and try to collect the data objectively, then to validate and make sure that the technology make a difference for the hospital in terms of like the environment, hospital, but also for our patients.
And what are the kind of differences that you look for when you're looking for technology today? What's the sort of things that you would really like that technology to deliver?
So for me, technology is important, and what technology has to deliver is to make the surgeon life easier, make the surgery safer, and also at the same time, at least guarantee the same outcome to patients, or if possible, even improve furthermore our patients' outcomes in a safe way.
And when you look at technology, do you also consider its impact on staff and sort of well-being and how the operating theatre works in general?
I think so. This is a very important aspect. We always focus on the hospital and the NHS in terms of cost effectiveness and patients' outcome. But when we can deliver the same or better outcome, but also looking after at ourselves and our staff in terms of well-being and ergonomics and preserve our health using technology, why not? This should be something extremely important and be part of the evaluation of any piece of technology, including in our everyday practice.
You were the consultant that led the work that became the kind of one extra case proof point. And you used Proximie's intelligence suite across, I think, 2 NHS robotic thoracic lists to capture key kind of time points and to implement optimizations. And I think, if memory serves me, the impact was quite significant. It was almost an hour, over 58 minutes per list. So when you think back to before those changes and after those changes, what was a good day in theatre before that extra case, and what does a good day in theatre look like for you now?
So for me, a good day in theater before introducing the technology and having an objective metrics on what we do and what we can achieve was to finish my list on time, doing 3 cases and finish by 5:30. Now, after I introduce the technology and I show the staff how we can save time in a safe environment for the staff and the patients, I noticed that I can easily do now 3 cases, finish my list on time, and I can safely and easily a 4th case routinely still finishing on time. That means that there's no any extra burden for the staff because we finish on time. We can then cutting down the waiting list and having more patients having surgery sooner rather than later.
And to capture that time, did you find that you had to change the way that you were performing the procedure, or was the time kind of around the procedure? Where did all that kind of time come from?
So most of that time came from around the procedure because, having an objective metrics of seeing what's happening in the anesthetic room, in the operating room, that gives you an idea how the time can be optimized and the flow of the patients can be optimized in order to save time. And of course, because I started to use Proximie to video record the procedure very early on, I also use Proximie to try to review my videos and improve my techniques and make sure that every step is consistent to make the surgery flawless and more efficient.
Thank you. And when you reviewed what was happening around the procedure, was there anything that jumped out and surprised you as to what was happening? Were there any unexpected insights?
Well, you can see that you don't realize that if you just move around the patient and you start to clean the operating room sooner, then you can save few minutes. Because in the everyday, you are so busy managing your patients that if you don't have a way to record and see it after a few days in an objective way, you kind of lose little changes which can make a difference. Because if you start to save 5 minutes per each step, as you said, at the end of the day, it makes an hour, and an hour is another case, and is another patient, and is at the end of the year, is many patients, they are waiting less for having their operations.
I'd just like to explore that a little bit. I mean, you as a surgeon, I guess, must have seen a very real impact on individual patients as those lists started to fill with that extra case. Can you give us a sense of what the human meaning is for an extra case? Because it maybe doesn't sound very much if you're not very sort of well versed in surgery. Is an extra case really meaningful? Does it make a difference?
That does, it makes a massive difference. And I will also make a step back because, since we started this efficiency program, we didn't have any cancellations in our theater. Of course, there may be cancellation for clinical reason, but the cancellation for overrunning or for not being efficient is pretty much zero now. And that extra case means a massive difference for the individual patients who can have his surgery sooner, but also for your waiting list, because we have noticed that now you can significantly cut down your waiting list using the same resources that you are using in your routine everyday NHS hospital. And that means that, even if it's one patient a day, like in our hospital, we have 2 thoracic lists a day per 5 days a week. So potentially you can operate 10 patients more every week. And in a month is about 40 patients. So that means that you can reduce your waiting time, and you can achieve that over 80% of your patients can have cancer surgery within the 24 days, which is nearly 3 weeks from the time we receive the referral. And this is, I think, the outcome that the NHS wants us to reach. And a lot of trusts, they are failing at the moment because there's an increased number of patients requiring operations, but the efficiency has not improved across the country as we were expecting, adopting some technologies like robotic surgery, for example.
And how do your staff feel about it? Because sometimes efficiency, we hear the word efficiency and we feel the word pressure. How did your staff respond to the idea of collecting this data and using it to improve processes, and how do they feel now?
Now they feel very proud of what we were able to achieve. And I think that is very important when you start to record in this kind of project, to establish the right culture within the team. This is not a blame culture. We'll not find any lazy member in the team. We try a way to work better in a safe environment, but be more efficient. So we don't want to blame anyone who increase the burden of work on everyone, but there are objective steps that you can do to work in the same way, but in a more efficient way, and everyone is going to have a benefit. And after they understand the purpose of the work, and now they see that we can deliver more cases, we always finish on time, no one of them is late to catch their train or to go off and miss their family, they really, really are happy about our program.
Great. And I guess how do you, or what would you like the sort of near future to look like? What would you like the next evolution of some of the technologies that you've been using to provide you as a surgeon?
I would love to see a broad adoption of this system across different hospitals to show that what we can do here can be done in many, many hospitals. It's just a way of collecting the data and comparing different hospitals in an objective way. And also keep using this technology, even in a hospital like us, when we achieve a high efficiency, we can still improve, not only in the patient's turnaround, but also in the surgery, because in the last couple of years, keep using Proximie also for monitoring my surgery, I noticed still some room to improve my surgical time again in a safe way. And I think that probably integrating more AI, we can have more objective elements to improve our performance, like they do with the video recording in like professional sports, for example.
That's interesting. Are there any particular moments in surgery that you'd be interested for AI to process, or do you have any thoughts on what specifically AI could do to help you as a surgeon?
So I think AI can look objectively at your surgery and sometimes can check the number of motions/movements you do to approach a certain area or certain part of your operations. And then you can calculate if you can do less or be more efficient in your movement. And if you use another example, like for example, sport, refined sports when like golf, when changing subtle movements can completely, change your performance. This can be translated in surgery, in your practice, and AI can help to objectively identify which areas of your operation can be improved safely.
Well, we usually end with just one very simple question. So beyond the act of operating the robot and fixing human beings, what does surgery mean to you today?
Surgery means a lot because, with surgery, of course, I can help my patients, but also I'm very excited about the integration of surgery and technology, not only in performing the operation, but also how technology can safely support your environment to be more efficient as a surgeon and as an institution.
Well, Mr. Bille, thank you so much for joining us today. It's been a pleasure to have you and to hear your insights into the world of surgery and how things are continuing to improve.
Thank you very much.
Thank you. Good luck with the rest of the day. Thank you.
Thank you.
So that was our conversation with Mr. Andrea Bille. I really enjoyed this one, and not just because of the numbers, but because of the way that Andrea talks about what's behind them, the people, the teamwork, and what one extra case really means when you picture a real-life patient waiting. The thing that I took from this episode was that small practical changes, but changes guided by real visibility, add up to meaningful impact, not losing what matters most in surgery. So thank you for watching.